But look at this. It's a tweet from Toronto's public health officer. Individuals who have died with COVID-19 but not as a result of COVID-19 are included in the case counts for COVID-19 deaths in Toronto. What? Let me read that again slowly. This is a real tweet, verified. Individuals who have died with COVID-19 but not as a result of COVID-19 are included in the case counts for COVID-19 deaths in Toronto. So if you had the virus but you weren't sick from it, certainly not in the hospital or intensive care, maybe you didn't even know you had it, but if you had it at all but died for any other reason, it was marked as a virus death. It would be like having a cold and then getting hit by a car or shot by a gun and it being chalked up to the virus. So even the falling numbers I showed you earlier, they're greatly padded. So not only is the pandemic over, it was probably over weeks ago. One more stat. This is the list of causes of death in Canada. Cancer's number 1, heart disease number 2. I think accidents are number 4, actually. It's interesting. Suicide is the 9th most common. But the latest stats for this are from 2018. In that year, 3,811 people committed suicide. What a tragedy. I bet for this year, 2020, it's going to be double that because of the pandemic, the lockdown, the unemployment, the stress, the mania in the media, the shutdown of life. But look at the number for influenza and pneumonia, the flu. Each year, it's the 6th largest cause of death in Canada. 8,511 deaths in 2018. 8,511. And as of yesterday, according to the federal government, the total count of deaths from the virus is 8,566, so almost exactly the same. And that includes padding the numbers with anyone who had the virus gets counted. And the pandemic is over. I suppose there will be a few more deaths. Certainly public health officials will continue their policies of calling any death a virus death for funding and political reasons. They just admitted it. And yet look at this. It's June 30th. Today the year is half over. The pandemic is done. You saw the curve. But look at this.
Well, good morning. Today, today, City Council will consider a report from Dr. Eileen Davila to effectively make it mandatory for people to wear masks or face coverings inside businesses or public facilities. Dr. Davila's recommendation, worked out with City Legal after careful consideration of the legal landscape, would give clear direction on face coverings to help stop the spread of COVID-19.
So masks will be made mandatory a week from now. So in July, the pandemic arrived in Toronto on January 25th, by the way. That was the first case that flew in from China 5 months ago. It's run its course now. And only now they're bringing in a mask requirement in July? They didn't close the borders. They still haven't closed the borders. They could have made masks mandatory, I suppose, if they actually believed masks stopped the virus. And I suppose in some cases, like close contact indoors, it does. Taiwan, they have masks for everybody. But to wait only until now? What on earth are they doing? They're being politicians. That's what. Always remember that. Look, public health officers may have a medical degree, but they're not like doctors who see patients. They don't treat individual patients. It would be nuts to wait 5 months after diagnosing a problem before you prescribe a prescription. These aren't people acting like real doctors. These are just politicians who happen to have a medical degree. Like politicians, they lie. Like politicians, they lust for power. That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.